Do consent forms have any meaning, or are they just clerical expression on a piece of paper to fulfill medico-legal requirements? Can the same copy of consent form be repeatedly used for multiple intervention? These are the interesting questions which has been raised by this recent judgment from the National Commission. In this case, the patient was diagnosed with Wolff-Parkinson-White syndrome, WPW syndrome. The patient was advised electrophysiological studies, EPS, following which a radio frequency ablation was performed, RFA. Post RFA, the patient developed a complete heart block. A temporary pacemaker was implanted. 3 days down the line, a permanent pacemaker was implanted. 2 months later, the patient had malfunction of the pacemaker. An intervention corrected the same. The patient filed a case of negligence against the hospital and the doctors. There were many allegations against the doctors and the hospital. But what was interesting was the observation of the court about the consent forms which were used in this intervention. The court observed there were 3 sets of consent forms. In the first one, the intervention mentioned was EPS. The patient had signed, a witness had signed, and there was no signature from the doctors. The court wondered, if the consent was for EPS, then RFA should not have been performed. If the RFA was performed, was the risks and the complication mentioned because the patient went into complete heart block? And the court wondered who was the doctor who took the consent. In the second consent form, the intervention mentioned was PPI, permanent pacemaker implantation. The court accepted the fact that the patient required a permanent pacemaker as he had gone into complete block. But the court wondered, was a discussion about the type of the pacemaker to be used, the cost of the pacemaker to be used, and the risk and the pros and cons of the pacemaker which was going to be used? Or did the hospital impose its choice on the patient as later on this pacemaker malfunctioned? Here too, the doctor's signature was not there, and hence the court wondered who took the consent of the patient. In the third set, the intervention mentioned was thoracotomy. Here too, the patient had signed, there was no witness signature and no doctor signature. The court wondered what were the details of the intervention performed. Friends, the National Commission has reiterated its previous judgment with this judgment, where it has discouraged the use of pre-printed consent forms. As the famous saying goes, one size never fits all. So the court held the hospital liable. Thank you.